Good afternoon, everyone. I'm Dr. Parjit. I'm the lecturer for PhD in MAHSA, and I'm the moderator for today's webinar. First of all, it's my pleasure to welcome all the participants for today's webinar. And it's the title today will be Compassion in Nursing. I'm very honored to introduce the speaker for today's webinar, Puan Hamidah binti Mahdi. I have known Puan Hamidah since 2007. She is a great person and she's the right person to talk about compassion in nursing. She been a registered nurse and she started her career in 1981 and earned advanced education in nursing in Malaysia. In total, she have about 32 years of clinical experience, out of which 17 years were in various disciplines in government and in private hospitals. And most of all, she has various international experiences with multiracial and multicultural nursing, especially in Maternity Hospital Abu Dhabi, in United Arab Emirates, and in Tripoli, Libya. So after serving 15 years in nursing education in various universities and colleges, she served as lecturer, head of program. Right, currently she's our deputy head of school at MAHSA University at Faculty of Medicine, Bioscience and Nursing, and she's providing, delivering, sharing knowledge and skill with our future generation of nurses. Without delay, I would like to invite Puan Hamidah to give her perspective on compassion on nursing. Puan Hamidah, it's yours.
Okay, Assalamualaikum warahmatullahi wabarakatuh and very good morning to everyone. Thank you very much for the opportunity for me one more time, okay, to give one more topic about the nursing. Topic is compassion in nursing. Okay, everyone, how does compassion in nursing affect patient care? Okay, as a nurse, we need to know what is actually our important role, okay, in giving care to the patient during their hospitalization. Okay, being a nurse is not just about physically caring for your patients, it's also about emotional supporting to them. As stated in American Nursing Association Code of Ethics, the number one first principle listed is the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. You see, the number one is compassion and respect. This sentiment echoed by patient families who consistently rank compassion among their highest healthcare needs. They need all this compassion from the nurses to ensure they are having comfortable sitting in the and live in the ward during their care. In nursing, you will see compassion often come together with the concept like empathy, sympathy, and caring. This is three elements, the most important elements during the care for our patients. But compassion care is more than just relieving suffering by treating physical problems. The compassion is play more important role because it's encompass for all the elements to ensure our patient stay comfortably in the ward, feeling having have a sense of belonging in the ward. They are not alone. They are not like isolated in the ward by themselves. Okay. Here, why compassion is a vital skill in the nursing field and how you can proactively demonstrate compassion to your patient as a nurse. Okay,
Thank you, Puan Hamida. I was very touched when you said that it helps in the treatment of the patient and improve the patient outcome. Can you please elaborate more on the how the compassion can help in improving the outcome? What's the importance there? Can you go deeper onto the subject, please? Thank you.
Yeah, thank you, Dr. Pradeep. Yeah, the importance of compassion in nursing. We are actually listing. I am the listing the list of what is important during the caring of patient with the during caring of patient in the ward. Okay, for compassionate attribution from the nurses to the patients. Practicing compassionate care help you to provide the best possible treatment and also improve patient outcome. Okay, number one, okay, compassion in nursing is it address loneliness and isolation. Okay, why I mentioned that loneliness and isolation, the medical treatment can be lonely experience because this kind of patient when they're admitted to the ward, they're actually out away from their homes, from their loved one. They are actually away from the surrounding that they are used to have to be with them. Now they are maybe in the room by themselves, okay, maybe they also may be unable to walk or to talk. So their only social interaction now is only with you, with the nurses. Okay, when they are in the hospital, that means they are actually have interaction with the nurses, with the healthcare provider, with the doctors, and especially with us because we are care for patient. Practicing compassionate during the interaction with patient can reduce, actually, it really can reduce their feeling of loneliness and feeling of isolation, feeling isolated in the ward during the time when they are being away from their family. This could be simple. The nurse can be just have a talk with them about their, maybe I'm just asking a simple question. What is your hobby? How is your day for today? So you have mentioned maybe they will happily mention and tell you about their experience, what happened to the past. They try to share with you when you are able to come to them, have a interaction and conversation with them. They are not lonely anymore. So the term when I mentioned earlier about loneliness and isolation can be avoided when you are come to your patient, have a time, give a little time, even a little bit time to talk to them. It be very meaningful to our patient. Okay, number two, beside the loneliness and isolation, okay, is easy anxiety. People, when, like the first time they entered the hospital, first time they admitted to seek the treatment, of course, in their mind, wow, where am I now? They feel so anxiety, so scary. What is actually going to happen to them? What kind of treatment they're going to receive in the hospital? So, uh, to share with them by sharing, by asking, yeah, um, by support them. Then when you give support, when you talk to them, you're asking something about their past history, about their treatment and so on. Then they will like a easy release. And they are no more anxiety in their self because they know there is someone to look after them. There are people to have interaction for them to just to express their feeling. Okay, then to receive the treatment means they can have an idea asking question to you. Then you become a right person to advise, to tell them about their treatment and support in the hospital. Okay, the extra effort in the compassions actually can easily ease their anxiety. When you come to them, you talk to them, they feel like, oh, they have sense of belonging in that hospital, in that ward. They become they feel, no more anxiety, and no more scary. Stay in the hospital because of your compassionate care to them. Okay, very you welcome them. Very kita kata overwhelming. Okay, and also of course they have positive attitude towards their recovery, and also about the post discharge instruction to comply with any instruction to follow, to taking medication and so on. Okay, number three, about the importance of compassion in nursing. I want to emphasize that actually it will make you feel better as an advocate, because we are advising our patient. When we are advised on everything, they are curious, they wanted to know, of course, they feel so secure. Hey, because you make them understand with their situation, with their needs, okay? Not just physical, but also it covers their emotional. We cover in nursing, we used to cover physically and mentally, physically and emotionally. That we can catch, you can see from the patient is actually how is actually their feeling. We can see, we can feel through our empathy, through our sympathy, and our caring care. Right? And also not to this kind of conversation, not only we communicate with our patient, we also communicate with their family members. It's bring more confidence, more confidence in patient and family members during for caring the patient during their hospitalization. And it's also improve communication between patient and nurses, between us and patient. Communication become better. How to connect us? How to connect us with patient is only through communication. We have many kind of communication, like verbal communication, non-verbal communication, even with your only uh, you see, you look into patient. When patient look into your face, when they look into your start, how you look into patient is actually they can understand you. You come with the sympathy. You come with some caring care for them. By practicing compassion in interaction, we also building trust. Okay, with you and also our client, our patient. They feel more comfortable communicating with us regarding many things until we are actually the person, the right person to dig actually whatever problem they have. They when they have trusted on us, they will tell us everything about them. And now it's actually like coincidentally we can get better history, we can do better history taking from our patient for their future treatment. Okay, and last but not least, the importance of our compassionate nursing is to improve overall patient well-being. Improve overall for overall patient well-being. People want to be treated with kindness and respect. This is what actually we deliver in our daily duty to our patient, especially during the difficult time. And now we know it's pandemic about COVID-19. It's very difficult for us to explain to patient, to family members about the outcome of this disease. Then of course, one thing that we know, one of the outcome is patient will be die. But this the thing. It's become in this situation, we might say the our communication, our compassionate become a crisis already. Crisis because you want to tell or you don't want to tell. But the outcome is still the same. And rather than doctor, we also become responsible person, okay, to make them understand the situation, the outcome, the prognosis about this COVID-19. Anyway, we hope uh, with this compassionate nursing that we provide for our patient will improve their health outcome, but will make everyone experience be easier and make our patient become more present with their staying in the hospital. We can't hear you, Dr. Pajit. Sorry.
Okay, sorry. With so many things going on in the clinical area, my concern is how, for example, there's too much documentation that is required. There is so much of activities going on. The demand on the nurses are tremendously increasing, and not only from the patient, from the doctors. Also, when I look at other aspect, like we have so little manpower because of too much of turnover, because of lack of manpower, for example. So, how exactly can we practice compassion in nursing? Can you give us some practical aspect how to? Thank you.
Okay, thank you, Dr. Pajit. Yes, it's actually uh, we have a little bit of a few steps, a few challenging to face during any situation, okay, in this hospital, because we are actually short of time, short of staff, we are short of support, just because in certain situation, the number of staff become, we mentioned about the staff are lacking of staff because the turnover is high. Then at that time we have to use the special challenge in ourselves how to overcome this kind of physical problem. It's not the about the instruments or what, really physical problem that occur. But it's actually we need to spend at least, if we say time is mm, very limited to be with patient, but try our best, even with a very short time to talk to patient, to go to patient, maybe with our therapeutic touch, therapeutic words for that very short period, it really mean for the patient. Maybe we think I can give you only a little bit, a small contribution to you, but maybe when they receive, when they get from us, the report is very much bigger and brighter for them to remember. And during their hospitalization, they receive very good care. Even they spend so much, a little time for them. Okay, but it's actually here are some tangible ways you can practice compassion uh, with your patient. Okay, number one, it's very important to put yourself in patient's shoe. Okay, we try to be a patient. Okay, put yourself as a patient. What you want, how environment you want to be for you to stay calm and comfortable in your ward. What kind of conversation when you want them nurses to come to you, talk to you, when the time you feel you're so lonely. So when this we try to convert the situation when we are a patient, okay, so what we want, and you try to have a feeling, empathy by the patient by giving them what actually have in your heart, in yourself. Okay, of course they want somebody to talk to them. So spend our time, go inside, knock, respect them. Okay, we knock the door, we give some privacy to them. Okay, now we got time to speak to them. Just asking, how are you? How are you feeling today? Or maybe how food's today? You see, if they say, when we ask this kind of question, let's say, oh, I don't like this kind of food. I want this something else. Now we get some important information from them. Or maybe you said, okay, or maybe this patient is so lonely. Of course, lonely in one room. So you go inside, just ask something, just have a good rapport. And we try to build a good rapport by asking their family members. Yeah, as early lah, I mentioned maybe their hobby and what actually they wanted to do, what is their future plan, and then we'll maybe talk about their diseases and way of overcome their disease and the way in a healthy way for to come with the food, with the medication and treatment, continuous treatment and so on. Okay, by then ask yourself that you can do to make them feel comfortable. This is the thing now. What else you want? That's the thing that you apply to your patient, right? Or maybe you can ask them directly. Ask directly. Then you can get the special answer from them. Okay, they take time to build up relationship. Even when the time is limited, the small gesture can be meaningful to them, as I mentioned earlier. Okay, by maybe telling them if I'm not around, if you need anything, show them the pushing when to push the button to call you, when to press the call bell to call you, or maybe if you have someone, maybe we can allow someone, their loved one, if their family members or their sibling to stay together. Yeah. Okay. Then we actually to become the first person who start the conversation. Maybe they feel so shy, want to talk to you. Maybe this is first time they admitted to the ward. No, we are the person who start the conversation, to try to put him or her in the comfortable situation, in the comfort zone. Okay, next the step, the practice, we will do some demonstrate respect to person. We must show our respect to our client by calling them by their name, with smile. Yeah, when you call people, hi, how are you? You smile with a smiling face. Of course, they will say that. Oh, you really accept them to be one of their patient. They know, they understand that you are very kindness. You are accept me as your patient. So I'm happily to share my anything, my problem, my happiness, my anything with you. Okay, so this is the better way. Demonstrate respect. So as I mentioned earlier, we knock the door. Why we knock the door? Because we want patient to feel that they have a privacy. Maybe they don't want you to come, they just don't answer. Yeah, okay, then only you step in, yeah, just call them by their name. Because when we respect people, when they feel respect, they're confident in you. When they feel respect, they're confident with you. Okay? Okay, then last but not least, when possible, go beyond the role of nurse. Not to say we have to go beyond, so beyond further, but what I mean is we can apply compassionate care too, providing appropriate touch, shake hand before shake hand. But now it's a pandemic; we are not allowed to shake hand. Maybe just show your kindness by putting your hand, we respect people. We should actually want to touch them, we want to shake hand, we want to have a good relationship by physically attachment. Yeah. Then of course when they trust you, you have the emotionally and inner connection with them. That one actually will bring up time by time when patient is under your care for certain period, certain times. Okay. Um, this is we call human connection. Human connection. We respect them, they respect us. But with the for the treatment, of course, this is what actually they should earn when they stay in the hospital. Okay, they will be very happy to stay with this kind of care they provided by the nurses. Um, and action to show compassionate is actually a little bit big. They actually we can be something that simple, very simple as I said, might be our behavior, right? Our behavior, smiling, just your body language will play a very important role. Your body language, you are welcome them, you accept them. They want to tell you something, you must be a good listener. Just listen to their opinion, to their anything they wanted to tell you. And this is sure that you give them a very good compassionate nursing care, compassion nursing care, that they are happy. I'm sure if we practice this kind of care on the compassionate compassion in nursing, of course, everybody who come to us, admitted to the work under us, will be happy and get a good treatment, external and internal. Thank you.
Yeah, I from what you have presented, from what I can gather is that we should actually compassion is so simple, yeah, but we should make it practice in our daily life. As all your example that you gave was very meaningful, and from my personal reflection and my take home from what your inspiring messages was that compassion is something like giving service with your full heart, yeah, with so much honesty, with respect, and that would make a difference to our patients. So and really, we should make compassion as a gold standard in our nursing practice. It is so important. It's so simple, yet it really needs to be reflected now and then. We stop here for today. I wish to thank Puan Hamida, and I wish to thank all of you for attending and participating in today's webinar. And I wish we could reflect more on this topic, and we from time to time share our personal reflection on this very important topic, compassion, when we need the most during this time. Thank you very much.
Welcome.
See
Thank
you all
you. Thank
again.
you.